Gauteng Health is visiting 3 hospitals affected by water shortages. The Rahima Musa and Helen Joseph hospitals, as well as the Pulusong in Kuruleni, have been dry for over a week now, and families of patients have been taking water and food to their loved ones. Our reporter eNCA's Heidi Giokos joins us now with the latest. And Heidi, that's exactly the question. I mean, what's the latest from where you stand? Yes, disappointingly enough, you were meant to speak to one of the executives at Rand Water, I understand, regarding what are the next steps in terms of addressing this issue. They have cancelled on you in terms of that conversation, but do we know as it stands what the latest developments are?
Yes, interestingly, Tumelo, I did receive a call from Joburg Water just a short while ago asking if we were available at 11:30 to do an interview, which is practically impossible because we are in Sakane at the moment. But they are willing to have an interview with us after their meeting with Rand Water. They obviously need to engage because there's a lot going on in terms of water supply and critically low levels of many reservoirs in the city of Johannesburg and surrounding areas. But we are at Pulusong Hospital here in Sakane, and this was one of the affected hospitals without water supply. But the staff here have decided to basically take matters into their own hands and try and provide alternative water supply because, depending on Joburg Water or Rand Water is obviously becoming problematic, and they remain unreliable given the fact that water is needed in hospitals, but that's not really the case at many hospitals because of the lack of water supply. But we are joined by Dr. Hlomile, who is the clinical manager at Pulusong Hospital. Thank you so much for your time, Doctor. We do appreciate it. Let's just speak about how long you did not have water here. You were telling me off air water was restored late last night. Very interesting that it was restored yesterday. But anyway, how long did you not have water for, and how difficult was it to operate without water?
Yeah, thanks, Heidi. We experienced a water shortage from last week, Thursday, and we were getting intermittent low pressures from the municipality until yesterday. Our water is finally restored right now. It is a very difficult thing to operate a hospital without water, and because we've experienced this a few times, we've obviously got some contingency measures that kept our essential services running the whole time.
Speak to us about those contingency measures, especially because you should be having the municipality, whether it falls under Joburg Water or Rand Water or whoever, they should be providing hospitals with water, but now you've had to take matters into your own hands.
Yes, I think, understanding the world we live in, if someone says there's a scarcity of water, we understand that our job is to provide quality health services. So some of those contingency measures were to just figure out how our water system works and make sure our water tankers actually deliver water directly into our reservoir system so that we can keep our taps running and ablutions going as far as possible. And currently behind you, the site behind you is just a construction site showing the new 500,000 litre water tanker that's going to be placed there, with estimates around the end of October. That will buy us more time. Should water be cut off, it just buys us more time to be able to provide water to the community.
Do you feel that the municipality, Joburg Water, Rand Water have failed you as healthcare workers, especially because you need water in a hospital? You need to have access to it 24/7 and not, here and there and through a tanker. Do you feel as though the municipality has failed you as healthcare workers, but also as patients coming to this hospital?
I think it's a very difficult question to answer because as a doctor, the first thing you're trying to think about is your patients. So it's very difficult for us to think only of us as a hospital and how we're affected. We're a part of Sakane. We can't remove ourselves from that. So it's been very tough to know that there's reports of scarcity of water, and it just affects the entire community. We try our best to make sure at all times we can supply them with emergency services, and then we go above and beyond and see if we can improve the experience of care, like we did yesterday by actually issuing out some 1 litre bottles just for walk-in patients at the hospital. So I think that's the sort of the spirit we're trying to carry. We're just trying to really do the best we can under the circumstances.
I want to ask you what happens when the water is not coming out of the taps. What have you done as a hospital to ensure that water does in fact come out of the taps? Because it's not a household where you can go outside, there's a tanker, you take buckets of water. This is an actual hospital. So what have you done to ensure that ablution facilities work, there's water coming out of the taps, and as you say, emergency services are provided to critical patients and just any patient that needs healthcare.
Okay, no, thanks. I think it was really about figuring out our water system, so understanding how our 2 reservoir tanks work on site and making sure we're putting water from tankers directly into those. We are also able to shunt water away from the less emergency services such as hospital residents and away from our boiler system, which of course affects our steam, which affects cooking, affects autoclave, affects heating, but it still allows us to actually then prioritize water in taps and ablutions so that you can actually still provide life-saving essential services.
So what you've done here is you've taken the water tankers fill up the reservoir and it gets into the hospital. Just explain that process for us.
Okay, so as they would come, we've got 2 tankers here, a 100,000 litre main reservoir just behind me, and then we've got a 60,000 litre tank right above the hospital. So we put water into the main reservoir tanker right behind me and pump that into our 60,000 litre above the hospital. That 60,000 litre reservoir actually just passively fills the water system. And we are able, like I said, to divert or shunt water away from what we would see as non-essential services during that time, just to really build up the levels of water that we have and conserve them for essential services. And that's our approach.
I want to ask, these water tankers, are they supplied by the municipality?
Yes, so we have 2 suppliers. We've had municipality supply us water tankers. When we have had to look at it and assess the situation, and sometimes it's just simply not enough. So to augment that, we've also added contracted water tankers to really fill up our reservoir and supply the water needed.
Okay, thank you so much. I'm just going to ask my colleague if you can just stand next to me, Doctor, so we can just leave you with the shots. I know I've been asked to wrap, but this is the reservoir, these are the water tankers, and this is going to be a second, maybe just quickly explain what the second part is going to be.
This is going to be a 500,000 litre water tank that will buy us from, instead of 1.5 days to about 5 to 6 days water supply at any time.
And when will that be ready?
This will be ready at the end of October.
Oh, fantastic. Okay, thank you so much. We really do appreciate it, Doctor. And I think that just really paints a picture of how hospitals are taking matters into their own hands, Tumelo, to really not be so dependent on a clearly unreliable Joburg Water and municipality. Obviously facing many challenges, but at the end of the day, like hospitals have been asked to be exempt from load shedding, they should be asked to also be exempt from water issues, because that's obviously the basic necessities and need for a hospital to function.
And I suppose, Heidi, that's why they have to act with a sense of urgency. They are dealing with lives, and they have to ensure that they protect lives, of course, at the same time. Our reporter Heidi Giokos, thank you so much for bringing us this update.